got a couple comments, perhaps, as much as questions. Dr. Grant, he's not here. I wanted to comment about the Institute of Medicine and their opinion on vitamin D. I am pleased to see that, yet again, the Institute of Medicine has been 100% consistent in making recommendations that make no sense clinically. So, and I'll also comment that a couple of years ago when we had the chief researcher on vitamin D from San Diego, the U.S. Naval Research Station, that talked about optimum levels of vitamin D in the blood, I asked him the question what he felt would be optimal. He said greater than 60 nanograms per milliliter. And he also said that you don't have to be concerned about toxicity until serum levels are over 150 nanograms. I will say that in my practice, my average dose for adults is 5,000 units a day. I don't know what the MD experiences are with that.
Yeah, I've been measuring vitamin D for years now, and so I've got a lot of experience with it. I can tell you that in order to get to that 60 or 70 nanograms per cc, it's pretty, in most people, say 70% of people, you're going to be needing to use 10 to 15,000 units a day to get to that mark. So don't be shy of that. You could use 20,000 units a day. I've done that in many people to get to that mark.
Well, I found that in giving vitamin D levels, when I get over 10,000 units orally, if I can't get their levels up, I'll switch to a sublingual lipoceutical spray, which I can use the same number of units and get the levels up there much easier. I think some people don't absorb it quite as well orally. They're taking it as a capsule.
Well, that could be. I'll tell you a couple other things too. Check your serum calcium when you're first starting to do this. There is a subset of people out there that this level of vitamin D will suppress out the parathyroid hormone. You'll see calcium levels go up, and so as long as you just check that periodically while you're doing the vitamin D levels, you won't run into that. It's a small group, but they're out there.
Yeah. And Doctor, I wanted to ask you if you've had any experience when you identify a specific tooth that you suspect is interfering with an organ system, if you ever do a little bubble of procaine right on the base of the tooth and the buccal surface is to block out that meridian and see what restoration of function you've seen. I've done that a lot.
Yeah, I do that when I was in the military, while I was in the line school. One retiree came to see me, and a lot of painting movies on, and when I check, I usually bring my EAD testing equipment when I'm in active duty, because I have a rank as a colonel, and nobody really stopped me. And I did the injection, so he couldn't move his arm. After that, within about 60 seconds, he could move his arm, gradually move all the way up. And I told the guys to see the dentist remove the root canal. And next thing I know, I get this threatening email from the commander of the dental group, the whole entire European group, threatening me. And I go through this all the time when I'm in active duty, so I do that all the time.
Thank you. I have a couple other comments. Dr. Haley, I don't know what it is that makes you hold back so much. Why don't you really tell us what you think? And Dr. Fletcher, could you comment a bit about the use of oral oxytocin, about its absorbability, what kind of dosing schedule you use for it, how effective is it relative to nasal sprays and other forms of administration?
What we have studied is right now at Chapel Hill, they're giving nasal oxytocin in children with autism. They were going around having to spray these kids' nose about 2-3 times a day. And 15 years ago, one of my patients had an accident, and she helped us to develop a sustained release oxytocin pill. And what's interesting is that after the accident, she developed severe right-sided breast pain, and after and she came to me, and I told her, I said, I suspect that there's something about sex and having orgasms that helps to relieve pain, and we suspicion it's oxytocin. So then she looked at me and she said, are you talking about Pitocin? I said, yeah. She said, well, I've had 5 boys. And she said, I was given a pit drip in every one of these 5 children. And she said, I'm 64 years old. I don't have a uterus. What are you worried about? Why don't you just give me a pit drip and let's see if the pain goes away? I said, great idea, you know. So I gave her the pit drip, and within an hour, she walked out of my office totally pain-free. At which point, you know, and then 16, you know, about, that was at 11 o'clock in the morning. At the next day, at about 4 or 5 o'clock in the morning, her fibromyalgia pain came back, her breast pain came back, everything was back. She showed up and she said, I'm your living guinea pig. She said, you don't need anything else. And I said, okay. So she helped us to develop a oxytocin pill, and she could say, the pain goes down, and she would time it from the time she took the pill to the time the breast pain was disappearing, this X number of minutes, and from the time she took the pill to the time that the breast pain would come back would be something like X number of hours. And so she literally would be able to give us when the pill stopped working, when the pill started working, etc. And so it's a proprietary technology that's been developed that allows for the oxytocin to be absorbed through the intestine and gets transmitted into the body through the thoracic duct, bypasses the liver, and gets put into the body. We know right now we have a small little girl in the practice who's got autism, and when she wakes up in the morning, she looks at her parents and she goes, and her dad says, honey, I don't know what you're saying, but let me go get your oxytocin. He gives her the oxytocin, and within 45 minutes, she looks at her father and says, Daddy, I'm hungry. Can you go get me some breakfast? Now, it turns out that the pill has pretty much been validated by this little 3-year-old, because she pretty much shows us that from the time the pill gets into the mouth, makes it through the intestine, through the stomach, into the intestine, into the bloodstream, past the blood-brain barrier, 45 minutes. And it's like, as long as the oxytocin is functional in her body, her speech is there. When that oxytocin pill wears off, she goes back to, and that's her speech. And so we know that these pills are functional, they work, and that they are penetrating the blood-brain barrier. So we then did, she was one of the original patients at Chapel Hill where they were using the nasal spray, and she did the same thing with the nasal spray. In fact, this child had seizures, and I think you'll notice that one of the gentlemen stood up and said, one of the most difficult type of autistic children to take care of are the ones with seizures. This kid, her seizures totally disappeared, and right now I got a phone call from the neurology department at the University of San Francisco. They're very interested in this child because they sat there and said, have you guys discovered a new way to take care of seizures? And I said, looks like we got one, because this kid with autism, her seizures have totally disappeared as long as she is taking her oxytocin.
Can you comment on safety of continued use of the oxytocin in pit bulls?
Sure. As you saw, oxytocin has molecular mimicry, and therefore one of the things that it mimics is arginine vasopressin. And so we have one patient up in Portland, Oregon, who when she takes 10 units of oxytocin has a problem with increased fluid retention. So she can gain 8 pounds in 3 days. 8 pounds is equal to about 1 gallon of fluid. But that happens probably 1 in every 4,000 or 5,000 patients. It's not a very common problem. Number 2, oxytocin drops cortisol levels. It's anti-HPA axis. It's a parasympathetic system stimulated. As a result, if you have somebody who is marginal for adrenal cortisol production and you give them oxytocin, folks, oxytocin makes you feel wonderful. Lack of, and if you take oxytocin and you start feeling bad, I'll guarantee you the adrenals are in trouble. And it's the production of cortisol from the adrenals, and oxytocin does have the ability to inhibit that production. So if somebody's marginal, it'll take them down. So those are the main two things that we've seen. Number three, oxytocin is the hormone that controls jealousy. So you'll notice that when you're in love and so on, that your spouse or your loved one will easily get jealous if you start paying attention to somebody else or to something like Saturday night sports or whatever, But the thing is that we now know that from giving oxytocin to people over the years, that we've seen an increase in jealousy that is occurring. So it also has the ability to increase cuddling. So it's the hormone that controls skin hunger. So guys, if you give your wife some oxytocin, do not walk away from her for the next 3 or 4 hours, because she will be extremely hungry for you, and if she can't find you, guess what? She's going to go find something else to do.
Thank you.
A question to Dr. Boyd Haley. Appreciate your comments on the utility of the DMSA urinary provocation test in relation to your comments that it doesn't get inside the cells. And the second question, what is your preferred mercury chelating agent, given your trial chelator is not available at this point in time?
First, I don't have a preferred chelation agent. I think we should talk to people who do chelation and look at patients. I don't have that experience. I can tell you from the literature and the animal studies that are done that we don't have a good chelation agent to remove mercury from the body. There's not one approved by the FDA or the EMA, and if you carefully look at the animal studies, DMPS and DMSA both will remove mercury from the bulk of the body and deposit it in the kidney if you're not careful. It has to be done very carefully. And you can actually kill an animal by chelating them if they have a significant mercury body burden. And the first question, I'm sorry, I have a kind of a hearing problem. So what was the first question?
The utility of the DMSA urinary